Yeah, hi everyone. It's Brian Newman with the Spotlight of Business Owner Show. Today we're thrilled to have Dr. Jae Chang with Chirowell. And Jay, welcome.
Thank you, Brian. Pleasure to be on your show.
Oh, thanks. Good to see you. Yeah, I've heard some other videos that you've done, and I'm quite impressed with the knowledge that you have. And I wanted to ask you, how did you get into the weight loss program as a chiropractor? I know that your full-time job as a chiropractor, it's kind of
Yes.
a rare thing to have a weight loss program also.
hmm Yeah, so to answer that question, it's a great question. So let me tell you a little bit about my personal background story before I talk about the weight loss program, how I got into the specific program that we're running at our clinic. So, so my personal story is this. I was born into a family with terrible, terrible, like the medical condition and health condition. So pretty much all my family's members are diabetic. So my grandma passed away from complete kidney failure due to diabetes. A bunch of my uncles had diabetes, and one of them passed away. And my dad recently had a surgery because of blood clot due to diabetes complication. So early on in my life, I was really concerned about just being healthy and just I don't want to end up like rest of my family members, with diabetes, or some of them have hypertension. So I really wanted to take care of myself. So I kind of followed the conventional wisdom at the time, which is like, to be healthy, to be lean, you have to like work out, for example, like 3 to 4 times a week, eat healthy meals. And they recommend eating like small meals, right? Like break it down to like 5, 6 meals a day and eat mostly protein, healthy protein, and kind of stay away from the carbs. So that's pretty much what I did like early on, like starting my college year. And but the problem was, I mean, I thought I was healthy. I thought I was following all that recommendation and doing well. But the thing was, I wasn't really feeling healthy. I wasn't really feeling a lot of energy. In fact, I was feeling tired, and my weight wasn't really going down. Actually, I was borderline like overweight. Okay, I mean, some of that is muscle, but I just so I got really frustrated. It's like, how can I stay lean? I mean, like more I worked out, exercise, or more I try to eat clean and healthy, I was actually gaining more weight, and I wasn't really feeling healthy, and I have more energy. I was feeling tired, and in fact, I was struggling with some blood pressure issues and acid reflux, and so I got so frustrated. And then a few years ago, about 2014 to be exact, this is when I actually had a complete paradigm shift. Okay, my mindset completely kind of like I had a light bulb moment. So when I met this, I met this a group of monks. Okay, these are not Buddhist monks; these are Christian monks, and they became my spiritual like mentors and friends. And what I noticed about their lifestyle was like so fascinating. It was like completely different and opposite of what I was doing. Okay, so being a monk, they were only eating like only 1 or 2 meals a day, and they were eating mostly the carbs. Okay, they weren't eating like protein, a lot of protein, or even like drinking protein shake that I was doing. And they weren't really exercising like I was, like 3 to 4 times a week. I mean, they were doing some manual work, but nothing close to what I was doing. And yet they appear so healthy and lean. Okay, so I was like, so what gives, and what's this paradox? What's the so I kind of looked further into it. I did more research about their lifestyle, and what really caught my attention was their lifestyle was centered around fasting. Okay,
Mhm.
and I'm sure you did fasting before, right? And now
It's
we call
tough.
this like,
It's tough to do that on your own. Yeah.
yeah, exactly. And now we call this intermittent fasting. And so I'm not saying like just starve or not eat for days, okay? But you just control what you're eating, like your portion and the frequency. I mean, that's really important. So once I watched how their lifestyle was different than mine, I was like, okay, maybe I should try that. I mean, because I tried other other programs and didn't work. So maybe if I just follow that, maybe it'll work. But then I had this fear. Okay, I had this fear in the back of my mind. It's like, okay, I mean, I've never done fasting before,
Mm.
and I didn't know how to do it. I didn't want to like. I was worried about maybe like going to starvation mode and losing muscle mass. And yeah, I just had all this bunch of questions. And like, so I was like, I knew that I have to try this, but I wasn't really sure. I wasn't like ready to jump in with both feet.
Uh-huh.
And then at the same year, I discovered this program, which is actually what we actually recommend to our patient. This program is called Chiropractor. You can see it right here in the back, this
Oh yeah.
logo. And this program really, so I discovered this program, and this program is actually developed by a chiropractor, interesting enough. And so this program follows the concept of intermittent fasting, okay, only eating 2 meals a day and controlling portion. So I was like, oh, maybe then if I do this, rather than just go, cold turkey, just go, just starving myself and fasting, maybe I'll try with the program. I might have better luck and better success. So I did, and I gave it a try. And I mean, it really amazed me. And so in just little as 2 weeks, I was down already 12 pounds.
Wow.
And I wasn't exercising. I wasn't eating a lot of food. I was actually eating just 2 meals a day, but eating in balance. And also my blood pressure was normalized, and I felt more energy, and also had a more like the mental clarity. So my cognitive function improved, and I was like, whoa, what was going on? I wasn't exercising, and yet I was like losing weight. But it actually wasn't just a weight; it was just actually body fat. It's just, actually, I measured myself; my inches were going down.
Oh, okay.
I
Were
was
you
like,
still exercising while you were doing the
actually, during this program, they didn't recommend doing exercise because you're controlling your calorie. You're going to low calorie. I mean, you can do very little exercise. So I did a kind of like walking around, very casual, minimal exercise, but nothing like I was doing before. And yet I was still losing weight. I was losing fat.
uh-huh.
So and I was like, wow. So this is pretty incredible. And I was really, even though it was intermittent fasting, I wasn't really hungry. I wasn't really feeling like I was starving. So I was like, well, maybe if it worked for me, then it will work for other people too. So then I started implementing it to my practice and recommending it to my patients, and the rest of it is history. I mean, I've seen some amazing, amazing like life transformation, you know,
Wow.
with my patients. And because here's the thing, I mean, like being a chiropractor, I see a lot of people with musculoskeletal condition, right, neck and back pain, hip pain, or whatever. But what I noticed is people who have weight issue, when they come in, no matter how many times I see them, adjust them, they still complain about pain,
Oh wow.
okay?
Wow.
Because they're carrying extra weight on their body. In fact, the Mayo Clinic research shows that if you add a pound of weight, you're putting 4 pounds of pressure, okay, on your weight-bearing joint. So if you're adding if you're carrying extra 20 pounds, you're adding about 80 pounds of pressure on your spine, or it could be hip or knee joint. I mean, that's just tremendous amount of stress. So if you can remove some of that by losing weight, I mean, that's why I've seen some patients who like first initially came to see me and I really didn't touch them at all. I say, okay, let's go ahead and try to get you some, lose some weight. And they lose about 20, 15 pounds. And some of them say their pain is completely gone.
Wow.
Gone
Wow.
after like losing weight. So that's why I was so fired up and passionate about this weight loss thing, because it really goes hand in hand
Hmm.
with chiropractic. And then if they still have a residual pain, and then I can address it. But first and foremost, I want to actually address the weight problem,
Oh, I
for my
see.
patients. So that's how I get started. And so, yeah, I mean, we're having a great success with this. And like I said, helping so many patients get their life back.
Yeah, Doc. Yeah, it's amazing. Yeah, I run a network group, and a lot of times I see members and attendees in my meetings that have weight loss programs. But if you drink this drink or take these
Mhm.
pills, and I was on Jenny Craig for years. Jenny
Okay.
Craig, and if you eat their food, this is kind of an interesting concept that by basically fasting,
Hmm.
that can help your weight loss program.
Yes.
So no, I mean, can people do this themselves? Or how come they can't just work on it themselves?
Well, they can, but I mean, the success rate is really low. I mean, almost like 99% failure. If you're trying to do some kind of diet or weight loss program, weight loss on your own, because there's two main reasons why it is so hard to do it yourself, especially when it comes to this kind of a fasting or dieting program. Number one is the obesity, overweight problem is not considered a medical problem, medical condition.
Mm.
Okay, so it's not just lack of willpower. I'm eating like too much food, too much calories. No, actually now it's proven fact that it has to be your insulin, hormonal problem, hormonal imbalance, hormonal disorder. So really have to address that to be able to have a successful weight loss. Okay, so it's a medical problem. That's why you need to have some type of medical supervision, preferably like doctor supervision program like we do. So make sure, like, because a lot of times people who are overweight, obese, they're already having some type of underlying diseases, right?
Uh-oh.
Medical conditions. So they're taking like diabetes medication, hypertension medication. So when they start losing weight, they need to be monitored closely, because as you lose weight, some of those dosages, medication have to be changed and updated, right?
Okay. Oh yeah.
So that's the main reason why, and so for the safety concern as well. And number two is the accountability. Okay. In fact, I was at 2019 last year. I was at the Obesity Forum, sponsored by American Obesity, the Board of American Obesity Medicine, and all the medical experts and the doctors were agreeing on two things. So two things. Number one was a portion control. This is for the successful weight loss. And second was the accountability. Okay.
Oh, okay.
And unfortunately, the statistics show us that within 2 years, 80% of the people regain their weight back.
That's what happened
Right.
with me and Jenny Craig.
Yeah.
As soon as I stopped their program, the weight came back.
Right.
So I
So
had to go back on it. Yeah.
yeah. So that's why it's so frustrating, because like once you're done with the program, then what do you need to do? So you got to have a long-term plan, to
Uh-oh.
be really be successful at it. And so, and another thing is when people try to lose their own without accountability, okay, they may lose some weight from maybe early part of the weight loss, maybe lose like 5-10 pounds. And then most people, I would say pretty much everybody will get stuck at some point,
Uh,
right? Their weight will plateau. Okay, it's not weight loss, not just like straight, shot down. It's like, kind of stair stepping. You go down, you lose weight and you get stuck. And then, so when people get stuck, then they don't know what to do, right? There's no people around them to guide them through how to break through the plateau, and then they simply give up. And that's why they kind of repeat. They may lose 5-10 pounds initially, and then they just quit, and they start trying different weight loss programs or diet programs. So they kind of like, get lost. So that's why you need accountability. For example, like, us, like we're doctor supervised programs. So we closely monitor their progress. And then we use a very specialized tracking software that we can actually,
oh,
on a daily basis, we can monitor patients' progress, how much weight they're losing, what kind of food they're eating, their
uh,
blood sugar level, their blood pressure level. So very much like 100% virtual, we can actually online, we can monitor their progress. So that's how you can ensure long-term success and make sure losing weight is actually, in my opinion, it's not that hard. Okay. I
yeah.
mean, anybody can lose weight using any kind of like, fat diet or whatever, but the keeping it off. I mean, this great news is like, personally for myself. So after I followed this lifestyle changes, I mean, ever since I lost like 20 pounds 6 years ago, I pretty much keep my weight off. I mean, my weight is like pretty much dead set. I mean, it doesn't really fluctuate. I mean, sometimes I eat a lot, but my weight come back to where I was before.
I always thought that, if I eat a lot, then I'll
Mhm.
work out like twice as much to try to get it
Mhm.
off. You know what I mean? But
Yeah.
that doesn't work, right?
No, that's not work. So, unfortunately, the whole calorie model, we're gonna throw it out the window.
Oh, really?
That's what we've been taught like last 56 years by our doctors. But now, a lot of studies, like the double-blind placebo studies, and all these studies are showing that the calorie control doesn't work, because it might work short term. People might lose a few pounds, but long-term studies, pretty much every single study shows that the calorie model doesn't work.
Oh, wow.
Now that's why we have to focus on now the hormonal aspect of it and see how we can help control the hormonal part of it.
Oh, okay. No, so yeah, I guess it sounds like, yeah, it's a total lifestyle change. Like I know even myself, like on the weekends, I'm able to control it more, and I only eat like 2 meals a day.
Mhm.
You know what I mean? During the week, it seems like I eat, 3 meals and then some. They always, I always learn to snack a little bit during
Right.
meals. Is that always so? Snacking in between meals, is that
So actually
is that a bad thing?
snacking, is actually, when it comes to weight loss, it's a bad idea.
Oh, really? Oh,
Yeah,
wow.
they say like, they say, oh, you eat like, that's why like, I mean, an interesting study, there was an interesting study about like how many times Americans eat on daily basis. On
Yeah.
average, people eat like 6, 7 times a day, including snacking. Okay.
Uh-huh.
So the reason why, I mean, just a kind of short, uh, like just a short stance, I'll tell you why snacking is bad. Because now, like, remember I talked to you about weight loss has with your hormonal problem, hormonal disorder. So we're specifically talking about insulin levels. So if you keep on snacking, you keep eating food, you're really gonna stimulate the insulin release from your body secretion. And insulin is actually helps store energy as a body fat, right?
Oh,
So that's why you keep eating. So that's why the problem is now, it's not okay. Well, what you eat is important too, but actually, as much important is like how much you. I mean, how often you eat, the frequency, and that's the part we don't really address when it comes to weight loss. We
mhm,
say, okay, we have to eat like a certain amount of food and a certain type of food, but we don't really talk about the frequency. And
mhm.
frequency when it comes to weight loss is really really important, and that's why the intermittent fasting works, and you can actually do this as lifestyle changes. You know, so for
Oh,
long-term success.
oh,
Um,
okay.
yeah.
That's interesting. Like, can you tell us some success stories that you've run across? From your patients
Sure.
or
Well,
clients?
there's so many that I can tell you about, but
Well, maybe just a couple.
yeah. So there's two that really kind of sticks to my mind. Is one person, individual. His name is Renee. In fact, I mean, all this testimony you can actually look it up on my website or go to Facebook page, and they have their testimonial. But Renee, so he was, I don't remember exactly how much weight, but in 6 weeks he dropped 48 pounds.
Wow.
Okay, 48,
Wow.
and it just like literally melted like butter. And he says he was like losing so fast, he was kind of like nervous. And but along with that, he was like he had hypertension for about 8 years or so. So he had chronic hypertension. And 3 weeks, okay, just 3 weeks into the program, he was completely off of medication.
Oh my
Okay,
God. Wow. That was another
so
question I was going to ask. Yeah, in your program, could you actually get off of your meds?
oh yeah,
That sounds
actually
like
that's actually one of the main kind of motivation for me personally, and for also a lot of my patients too, help
wow.
them get off medication. So that's one of them. But anyway, and then his wife, her name is Anna, and they both did it together, and she lost 27 pounds, and they total lost about like 70 pounds altogether in 6 weeks. But here's another really interesting. The highlight is this. So after about 2 months later, he texted me. He text messaged me saying, "Hey, Dr. Chang, thanks for doing all this for me." And like he was at a company. He took a picture of his company. He was doing like some kind of fishing contest, at his company. And he
Uh-huh.
said, "Hey, Dr. Chang, I just want to let you know I lost additional like 30 pounds since I finished the program." So he was already down then over like 70, close to 80 pounds in just a matter of 3 months.
Wow.
Okay.
Wow.
So he did a part. So he lost about 48 pounds in my program. He continued to lead the lifestyle and lose additional 30 pounds. And so it's like one of the things really kind of motivate myself is like both of them, they say, "Hey, we'll never go back to our old lifestyle," because they've seen some tremendous transformation, lifestyle change. They say they want to go back. So that's like one story. And the second story is a lady, and she's a 72-year-old retired nurse. Okay. And
Uh-huh.
speaking of medication, she was on nine, okay, like 9 different medications, right? And
Yeah.
when I met her, she goes, "Hey, Dr. Chang, my main goal is just get off some of the medication, right? And
Uh-huh.
losing weight is great, but that's my goal." So sure, I mean, we can possibly help you with that. So check this out. So in just 2 weeks, okay, 2 weeks into the program, she was off of already like 3 medication, and
Wow.
like mostly diabetic medication. And so she lost like 25 pounds, and she's 72 years old. And she's like, and I was like, so that's why I'm telling people like you're never too late to lose weight. Okay.
Uh-huh.
People say, "Oh, I'm a little too old," and and all the excuses, you can
Yeah.
pretty much throw out the window. So, and so she said like she tried like pretty much every kind of like weight loss program on the planet, and she said like by far my program was like easiest, and yeah, it's most applicable and most like practical. And now
Uh-huh.
she's living the lifestyle. So she's continued to, she texts me every once in a while and she's like, hey, I'm still maintaining my weight. I'm doing this. And so after 6 weeks, she pretty much got it, you know? So
Uh-huh.
she's, so I've seen patients who reverse diabetes in just a matter of weeks. I mean, it's now possible to reverse type 2 diabetes,
Wow.
okay, by simply dropping weight.
That's
And
phenomenal.
and I mean, I have some patients who was on the insulin shot, you know, and some of those medications are not cheap, you know, they're like, she's spending about $500 a month for this insulin shot, and then she no longer had to take it. So she was already like saving a lot of money too,
Oh,
you
okay.
know?
Wow.
So,
Wow.
yeah.
No, that's phenomenal. Yeah, so we're talking with Dr. Jae Chang, and you could reach out to him at 480-485-6655. Again, 480-485-6655. He's an amazing doctor. Uh, I don't know many that run a weight loss program. Doc, so how do they sign up with your program? Do you have a website they go to? Do they just call
Uh,
you? Is it
yeah, I have a
month to month?
website,
How does it work?
so right now, obviously, because of the whole like the COVID-19 thing, so we're actually now running our whole program 100% virtual. So
Oh,
now people can sign up online, or if they actually call or text message me, it's like, hey, I'm interested in your program. So what I'll do is I'll send them a link, and it's an online intake, patient intake form. So there's like several pages of information you fill out, and then what I'll do is I want to review that and make sure you're a good candidate. So we don't just accept people who signed up. I mean, there's a certain criteria we have to the clients or patient has to meet. So we kind of screen them out that way. So make sure they're going to be a good candidate. And then once I feel once they're considered a good candidate, then we're going to set up a like an hour long, like a Zoom, like online meeting like this, do a
uh,
consultation. And this is a free consultation. Okay, we don't charge anything though. There's no risk free. There's just make sure that you're gonna, you know, whoever is gonna be on my program is a good fit, because I really want to work with people who are, you know, really serious about losing weight and motivated and wanted to stick it, you know, for long term, right?
so
So,
yeah, no, it sounds phenomenal. How soon would they be able to see weight coming off of their body? I mean, is it so if
oh,
they
you know, it
start
could be, I mean, it could be like on average, I mean, I would say like first week, I've seen patients lose about anywhere from 5 to 9 pounds
in 1 week?
1 week.
Wow.
And so on average, I would say about half pound for female patients and a pound uh, per man. So initially, the first couple of weeks, I mean, you'll typically drop a lot more weight, and then after
Uh,
that, your body starts to kind of get used to it and start to kind of slow down. But and there's a way why we, you know, there's again, you know, there's it goes into more specific, but you know, we can explain to the patient how that works, how they can lose so much weight in just a short period of time, following a specific principles, you know.
oh, okay. Okay. So again, yeah, we're talking to Dr. Jae Chang, and his number is 480-485-6655. Doc, yeah, we're going to have to wrap it up. Are there any last comments that you want to tell anyone?
Let's see. Okay, well, I guess one comment is I think I shared with you guys too before. Did a little presentation of COVID-19 and overweight, obesity, the weight management. So I believe now is more than ever is very important time to really take control of your weight. Okay,
Yeah.
because now is, you know, it's proven fact that the obesity and overweight is a leading cause of severe complication and hospitalization associated with COVID-19, you
Wow.
know, infection. And and plus now people are coming out of quarantine and they pack on extra, you know, 10, 15 pounds and looking for a way to quickly lose weight. And, you know, summer is coming up. So the great news is, like, you know, for my program, you don't have to show up. You don't have to set a foot in my door. We can all do this in online. And I know some people are still kind of, I know the gyms are open though, right?
Oh,
But some
yeah.
people are still kind of leery about going to gym, you know, and, you know, being surrounded by, you know, a crowd of people, you know. So
Yeah.
again, you can do this at comfort of your home, and a very easy, simple way to do it. But we teach you how to eat, how to, basically there's no exercise, there's no other pills or any other shakes. We're teaching you how to eat whole food and change your lifestyle in 6 weeks. Once you do that, I mean, you can pretty much set for life.
Boy, what better way is that to lose weight? No pills, no exercise. I mean, what else can you ask for, you know? No, that's
Right.
phenomenal. Yeah, Doc, yeah, thank you so much. I know I've heard some of your other videos, and again, you're always like informing and educating and just a wealth of knowledge, you know? And I'm so
Thank you, Brian.
grateful that I met you. So thanks for being on my show.
Pleasure.
Really
Thank you.
appreciate it. Okay, we'll talk to you soon.
Okay. Thank you, Brian. Take
Okay.
care.